All right, good evening, everybody. Environmental aspect for dementia management. Let me start. Let me introduce myself first, okay? My name is Junichi Fukui. You can call me Jack. I'm a certified care worker, social worker, mental health social worker, and also I'm a dementia care expert. Let me explain my activities every day, okay? Now I'm living in Japan, Kyoto City. My occupation is a home helper. Home helper is one of home care services, which is that the care worker visit each patient's house to give caregiving service. Do you know what the home helper does? Actually, it is a very, variety of activities. Not only physical care, but also household affairs such as cooking, cleaning, and laundry work. By the way, do you know the specialty of a care worker, of course, including a home helper? Do you know what is the specialty? Okay, care worker is to support the patient to lead their everyday life, right? In short, the specialty of care worker is to provide everyday life support. Therefore, physical care is not enough. Household work is also very important because our specialty is, providing everyday life support. That's why I did cooking at the patient's house and also, of course, assistant with feeding. And I should, change a diaper as well. Okay. Aside from the ordinary activity for care workers, since I am a shiatsu therapist, shiatsu is a Japanese traditional massage. I can give a massage and stretching exercise to the patient, as well as my colleagues, other care workers who suffered from low back pain. Look at the right picture. I put kinesio tape, black one, kinesio tape, which can help to support the function of muscle and lessen the burden on the lower back. It is very helpful. I always put the kinesio tape on the lower back of my colleague. And actually, I have two personas. One is a home helper. The other is a teacher. I'm a teacher of Japanese style of caregiving. I have trained foreign care workers who want to work in Japan. This is a picture 3 years ago in the Philippines. Before pandemic, I gave the lecture to the Filipino care worker in the Philippines. But now, since I'm in Japan, I have taught foreign care worker in the online class. This is my activity right now. It is very interesting because today I'm a care worker, home helper, but tomorrow I'm a teacher in the field of caregiving. Honestly speaking, I'm certified to engage in two occupations at the same time because I can teach students about my real experience and the knowledge that I learned on the side of caregiving field. Let's move on the topics today. This is the content that I will explain. I will talk. Number one, occupancy rate of dementia people in public nursing facilities in Japan. Number two, why an environment in dementia care is important. Number three, caregivers' responsibility regarding patient environment. Number four, improving patient environment using PEAP Japan. Let me start with this. Occupancy rate of dementia people in public nursing facility in Japan. I will explain the situation in Japan. We have the long-term care insurance system. People with 65 years old are eligible for the service of long-term care insurance. There are three types of facility services. Number one, social welfare facilities for the elderly requiring care. This is to provide nursing care services to the elderly who can't live in their home anymore due to severe physical or mental disease. Number two, health service facility for the elderly requiring care. This is to provide daily assistance as well as rehabilitation. The patients in this facility are expected to stay short period of time, not for good, and they are expected to go back home. So that while they are staying in the facility, they recover and regain the ability to live a daily life because they are expected to go home. Okay. Last one is care-based medical facility for the elderly. Okay. This facility provide not only nursing care, but also medical treatment. The elderly people who need medical treatment, such as tube feeding or from suction, and need respiration assistance device, I mean the oxygen, and other medical treatment are able to enter these facilities. So these three are public nursing facilities. No matter how rich or poor you are, they are eligible to use these facility care services with proper amount of fee, which is depending on their financial situation. On the other hand, there are many kinds of private nursing home or assisted living in Japan. But today, I just talk about public nursing home. Next, I want to explain criteria for assessing self-sufficiency. Criteria for assessing self-sufficiency of elderly with dementia in daily living is to show the level of independence in everyday life activities. But it doesn't equal to a medical diagnosis. Okay? Level 1 is most independent, and level 5 is the most dependent on daily living. Level 1, a few symptoms of dementia begin to manifest themselves, but the elderly is still capable of conducting most activities of daily living. Level 2, behavior and psychological symptoms begin to cause inconvenience in daily activity, while the elderly experience increasing difficulty of communication. He can still conduct himself with assistance. So from this level, they can start to use home help service, like what I'm doing now. Level 3, behavior and psychological symptoms occasionally disrupt the elderly daily activities, while communication difficulty also increase. Level 4, behavior and psychological symptoms disrupt the elderly daily activity, while communication difficulty also increase. This is more severe than level 3. Level 5, the elderly requires medical treatment and care as he begins to display clear psychological or behavioral symptoms and or severe physical symptoms. In level 5, generally, people cannot live in their home, so that they need to move to nursing home. All right, look at the occupation rate of people with dementia in public nursing facilities. Most of patients in the facilities have dementia. That's why facilities for the elderly need to provide dementia care. Okay, next, what I want to tell you, why environment is important for dementia care. Why it is not enough to provide just physical and mental care. How does the environment influence people with dementia? Actually, healthy adults like us have 3 areas, composed of 3 areas: body, mind, and lifestyle. These three areas have interacted with one another independently. Okay? Healthy adults can control each part, like maintaining physical and mental condition healthy. If we have disease or any physical or mental problem, we might check or review our lifestyle and correct it, right? But on the other hand, when we get older, the body and mind cannot maintain a certain distance and become strongly interdependent. As a result, they have difficulty to control each part. In case of the elderly with dementia, the borderline that separates body, mind, and the outside world becomes blurred, very obscured. When the mind is unstable, the body becomes weak. When the body gets weak, the elderly immediately feel anxiety or confusion. When surrounding environment changes slightly, the elderly body and mind also become unstable. Especially for the patient elderly with dementia, their mind are more vulnerable to mental illness like disorientation. If environment change even slightly, disorientation is one of the core symptoms of dementia. It renders the patient to become aware of what season she or he is, what time is it, where his or her room. Patient increasing disorientation is prone to anxiety and confusion. Therefore, we should arrange a calm and proper environment which can alleviate patient disorientation. Another reason why we should arrange the environment is their patient difficulty to adjust the new environment. Due to dementia patient cognitive impairment and inability to perform ADL, patients are unable to change their environment to what they want. Caregivers, that's why caregivers and other professions work together to reform, redecorate, and renovate patient surroundings to achieve satisfactory and pleasant environment. It is possible to ease problem dementia has caused by readjusting and arranging the environment. In other words, when the care environment improves, the dementia elderly mind and body become stable. Therefore, it is very, very important to arrange the environment for the elderly with dementia. Okay, now you understand why the environment is important for the elderly with dementia, I believe. But you might have a question like this. Okay, care worker has nothing to do with the environment. Am I correct? The care environment, like building and the patient room, are already given, so that the care worker provide care services in the given environment, not to change it. That you might have, that you might come up with. But actually, care worker need to take responsibility on the patient environment as well. Okay, look at the principle of Japanese style of caregiving. Okay, there are three principles. Number one, caregiving that maintains dignity. Number two, supporting independence. Number three, arranging living environment. As you can see, arranging the patient environment is one of the principles in Japanese way of caregiving. Why care worker take responsibility for the environment? As I already told you, that the specialty of care worker, right? Do you remember? Care worker, the specialty of care worker, professionality of care worker is to provide everyday life support. Unlike other professions, nurse, doctor, physical therapist or occupational therapist. A care worker can stay with a user 24 hours a day and 365 days a year, so that the care worker can know every aspect of user or patient life, not only their favorite food, favorite clothes, or favorite place, but also their sense of value and way of thinking, their history. Okay, therefore, care worker is the right person to contribute to arranging the patient living environment based on the patient value. Okay? In terms of environment, care worker can mainly play two roles to play important improve the patient environment. Number one, to coordinate and adjust the diverse factors surrounding the patient, reforming, redecorating, and renovating patient surrounding to achieve a satisfactory and pleasant environment. Number two, a caregiver or care worker become a part of the overall everyday environment of the patient. Let me explain it further. Environment is a complex system in which these three types of factors interact with one another. Number one, social factor. In terms of social factor, caregivers, response and attitude, family member, friends, neighbors, etc. Response and attitude. Actually, the consciousness of society and the people around the patient, that is the social factor. As you can see, caregiver is considered as a part of the environment of the patient. Number two, physical factor. Okay. In terms of physical factor, building facility and space, layout of building and the patient room, furniture, item, etc. Even neighboring environment. Maybe things in physical factor is that you might come up with when you hear environment, something material. Okay. Number three is the operational factor. Okay. In terms of operational factor, operational policies and program, procedure designated to enhance patient autonomy and motivation. Economical support which can improve physical and social environment. Okay. In order to support dementia patients to lead their daily living, support everyday life of the patient, we need to integrate social, physical, and operational environment based on the patient living goals, based on patient treatment goal and care goals. It is not enough to care for the physical aspect of environment, something material, but also social and operational environment are important. All right. Next, improving patient environment using PAP Japan. What is PAP Japan? PAP stands for Professional Environmental Assessment Protocol. It is first developed in USA based on the premise that the environment where the cognitively impaired elderly can maintain autonomous daily living should be assessed. The original PAP is a scale that measures the extent of environmental care provided for patients with dementia. Japan has adopted PAP and modified it into a scale of criteria for patient environment, which is PAP Japan. This is the composition of PAP Japan. There are the 8 domains of PAP Japan. Let's see each domain. Number one, supporting for orientation. Orientation is the ability to recognize time, space, and surrounding people properly. Okay, if you lose the ability of orientation, that is disorientation. Okay, one of the core symptoms of dementia. So supporting for orientation is like from the environmental factor. Okay, like open kitchen. If the kitchen is designed as a public space open to the view of passerby, patients in the facility can easily participate in simple cooking activities. Even when the patients are unable to participate in cooking activity, the kitchen helps them to retain proper orientation to its location and the surrounding area. Number 2, supporting functional ability. To help dementia patients perform various activities of daily living as much as possible on their own, like eating, taking baths, moving, grooming, and excreting, cooking as well. Okay? For example, when helping patients eat, adjust the height of the table or chair, equip them with aid device, making eating environment as enjoyable as possible. Okay, look at these pictures, 2 pictures. Changing from wheelchair to dining chair suitable for the patient, his eating posture gets better so that he can chew and swallow more smoothly. It can support the functional ability. Number 3, improving the quality and coordination of environmental stimuli. Increasing the amount of present stimuli and minimize the amount of stressful stimuli patients have received. A good design with effective use of lighting, color contrast, noise limiting measures, and a clear orientation clue can considerably affect patient ability to understand and function. Look at these pictures. Tatami. Tatami floor, which are commonly found in middle-class Japanese homes. Therefore, tatami floor can make the Japanese patient feel more comfortable, as if they would live in their home. In addition, the color and the smell of tatami create the pleasant stimuli to the patient. Okay, number 4, providing a safe and reassuring environment. To minimize factors in patient surroundings that threaten their safety, to provide support and reassurance for patients, to monitor patients and guide their movement in and around their room, hallways, bathroom, and so forth in the safest manner. This picture shows the care staff at the care facility working along with patients in dining room. This way of working enables the caregiver to observe and assist the patient naturally. Okay, look at this. The patient also feel more comfortable and reassured when their caregiver is around. Number 5, supporting the continuity of living condition. To surround the patient with personal effect brought from their home, to make the care facility appear as homey as possible. Okay, patient furniture and favorite objects should be brought from their home whenever possible. Patients can feel more stable and reassured when they look around and find these objects nearby. And also, these objects relay important information to care workers about patient taste, preference, and lifestyle. Professional caregivers should make effort to learn about the specific history of these objects and their relations to the patient. Okay. Because specialty of care worker is to provide everyday life support. Okay, everyday life is, different. It's different. Okay, because everybody has a different lifestyle. So care worker should know patient or user lifestyle. Okay. Number 6, supporting the patient's own choice. To let the patient choose their favorite spot and stay there. To assign the specific area of common room to individual patient. This picture shows the common room facility. It is a single open space, but put partition in such a way that different patients can use it at the same time without being interfered with by one another. We should keep in mind that when assigning specific area to individual patient, it is important to let the patient decide, depending on their mood and the circumstance of a given day. Okay? Let patient choose, rather than caregiver choose for patient. Number 7, protecting the patient privacy. To respect the patient wish, either to spend time alone or socialize and interact with others, to ensure the patient's personal space and privacy in the common room. This picture shows the bedroom for 4 people, which is divided into private space by the arrangement of furniture to protect each roommate privacy. This way of arrangement makes it possible to allow patients to enjoy both the benefit of the open space and the closed space. Last one, 8, promoting interaction among patients. What kind of change for patient living environment can maximize interaction with other patients? To provide a common space that promote meeting and interaction. To make use of appropriate tools that facilitate communication and interaction. Right? This picture shows how a common room is arranged with various objects of daily living in a way that promote interaction among patients. Art and handcraft work that the patient made are displayed. It can promote communication among patients. And look at this. She is decorating the room with New Year ceremony goods. It could be a good topic for patients to communicate, right? Okay. How to use PAP Japan? PAP Japan can be used for the guideline for reviewing the purpose and the significance of environmental care. And PAP Japan provides a useful common terminology in which you can communicate with experts from other specialties in discussing patient environment. Of course, you can start assessing and improving patient environment using, any domain of PAP Japan. All right, conclusion. It is important for caregivers to recognize that they are capable of changing and improving the environment surrounding their patient. It is better to aim first to change the physical environment of nursing facility, and from there, cause a ripple effect generating improvement in care and management environment, which is a social environment and operational environment comes next. Okay? We should improve 3 factors of environment so that it would contribute to the improvement of quality of life of elderly people with dementia. Okay, this is last slide. Okay, and also last message. Please keep this picture in your mind. Okay, in terms of environment for elderly with dementia, social environment, physical environment, and operational environment should be integrated, should be considered. Okay, and based on patient living goals, treatment goals, and care goals, we should arrange and prepare for the environment of patient with dementia. Okay, that's all. Thank you very much.